On this X-ray we can see extensive free air below the right hemidiaphragm. If you look at the diaphragm on the right, it's elevated and there's a lucency just below it. So that's the air right there. So that's the dome of the liver. That there is normal air in the stomach. Now, when you see free air below the diaphragm, that usually means perforation, so you should do an X-ray of the abdomen. That's the X-ray right there. So what we're seeing here is air outside the bowel. You can see air in the portal veins and air outside the colon. More air in the pelvis, always outside the bowel. So when you see air outside the bowel, that's called the Wriggler sign. I'll just write it down there. So in the Wriggler sign, the bowel becomes much more easy. The outer bowel wall is clearly defined by air. Now, once you have a perforation, you should do a CT scan to try and identify the cause of the perforation. That was done here. Again, on the CT, we can see free air just below the diaphragm. There's the diaphragm there. If we go down through the abdomen, we can see the stomach full of fluid, and then nasogastric tube inside. And all this air, all this black area is free air. So free air. So the next step is to look for the cause of the free air. If you go down the abdomen, you can see a lot of inflammation around the sigmoid colon. So in this case, it's hard to say the exact site, but it's definitely around the sigmoid colon, because that's where most of the inflammation is, as you can see there. So it's probably a diverticular abscess or a diverticulitis which has perforated. That's the commonest cause. You also see a small collection here. So the space here, you can see it's outside the bowel, it doesn't have the normal bowel wall around it, and you have air and fluid. So that's a collection in the pelvis, and that's quite common after a diverticular perforation. also see a bit more free air there. Now it's easier to see free air on, sorry, there's another collection there. So this is what we saw on the x-ray. If you go back to the x-ray, so when you see this free air in the pelvis, so that corresponds to this collection that we're seeing here. And the collection contains air and fluid. That's another collection there. So this is the diagnosis. It's a diverticular perforation with free air and pelvis collections.